Greetings, dear fellow doctors and colleagues. Thank you for the opportunity that has given to me to give a presentation in this pertemuan ilmiah tahunan Perdami ke-48 in Yogyakarta. Allow me to introduce myself. My name is Rijena Karina Abigael Bangun. I'm a general practitioner in SMAC Eye Hospital, Medan. Now I would like to present to you my e-poster titled Topical Immunosuppressant Agent Cyclosporine or CSA as Therapy for Ocular Alkali Chemical Injury. Is it really beneficial? So for the introduction, as we know, alkali chemicals can cause more severe ocular injury than acid chemicals because the alkali can rapidly penetrate the cornea into the anterior chamber of the eye and damage the iris, ciliary body, lens, and trabecular meshwork, which can cause significant visual impairment. In this e-poster, a topical immunosuppressant cyclosporine, which is also known as cyclosporine A, or may abbreviate it as CSA, was used in this treatment. So for case illustration, herein a 3-year-old male patient presented painful eyes 3 days after an accidental ocular injury with calcium hydroxide, which is commonly known as kapur sirih and commonly used in household. So the ophthalmic examination revealed based on Roper Hall grading, the injuries indicated grade 3 to 4 right eye and left eye, which we can see on figure 1. So from this figure 1, this is right eye and left eye. We can see both eyes showed corneal haziness. And we performed the corneal OCT, and the corneal OCT showed epithelial to anterior stromal thickening, as we can see here. And the initial examination showed the patient's BCVA of the right eye 260 and the left eye 20 to 100. The patient was hospitalized and underwent intensive conservative pharmacologic therapy, which were topical CSA, lubricating eye drops, steroid therapy, ascorbat, doxycycline, and continuous irrigation of the eyes. And the corneal healing was examined by serial corneal OCT. And from this picture, figure 2, we can see this is the last follow-up of the patient, which at 4 months follow-up, we can see the right eye and the left eye showed the significant improvement of the corneal haziness. And the OCT showed that a decrease in the density of infiltrates in the epithelium and the stroma. You can see here the epithelium and the stroma. So for the discussion, the mechanism of the cyclosporine or CSA, it reduced the pro-inflammatory cytokines, and including the number of CD3 positive cells or T lymphocytes, and which was associated the decreased expression of MMP9, nitric oxide synthase, VEGF, and active caspase. So, as we know, the alkali burn may cause corneal neovascularization. And the corneal neovascularization is a clinical condition caused by alkali burn that, when left untreated, leads to significant visual impairment. And one of the pro-inflammatory cytokines, VEGF-A, is one of the most important mediators of the angiogenesis, leading to the neovascularization. And the cyclosporine also reduce VEGF-A. Hence, topical cyclosporine eye drops may play a role in the treatment of the alkali corneal injury. From this graphic, we can see that the cyclosporine is an immunosuppressant agent, and it can inhibit the process of the corneal neovascularization. So, from the conclusion of the e-posters, this case report showed that topical CSA gave a significant corneal wound healing combined with the mainstay of alkali chemical injury. Here are the references that I use. Thank you for your attention.